breast cancer is the most commonly diagnosed cancer among women, with approximately 1 in 7 Alberta women expected to develop breast cancer in their lifetime. The fear and dread when you know something is growing inside of you that shouldn't be. That is spreading, and the longer that you wait, your chances get worse. But only 30% of breast cancer surgeries are completed in the recommended time frame because under the UCP, wait times are increasing. Why has the Minister for Primary Care failed to get Alberta women reduced wait times for breast cancer treatment?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And breast cancer is a very serious issue for women, and it's why we have increased the screening. We were, in fact, Mr. Speaker, the very first province in all of Canada to lower the age for breast cancer screening to under 50. We're actually going to be making an announcement shortly to lower it even further, but I don't want to preempt that. We are also seeing an increase in the number of women getting screened. Since 2020, we've had a 104% increase in the women that are getting their mammograms. That's good news, Mr. Speaker.
Honourable member.
Given reduced investment upstream almost always means higher demand downstream, more emergency presentations, more advanced cancer diagnosis, longer hospital stays, and growing pressure on oncology. Given that early detection is the best way to reduce wait times, but the UCP is cutting the very programs that help catch cancer early, leading to later diagnosis. Will the Minister of Primary Care immediately reverse the UCP cuts to cancer screening, prevention, and diagnosis, and get Alberta women the breast cancer treatments that they need?
The Honourable Minister.
Thank you, Mr. Speaker. In fact, I have to correct the member opposite. There were no cuts. In fact, Mr. Speaker, we're increasing the amount of screening that we're doing, not just for breast cancer, but also for colorectal cancer, for lung cancer, for cervical cancer, and for prostate cancer. Mr. Speaker, we've added investment over the years, and we're going to continue to add that investment because the earlier that we can catch these cancers, the better prognosis and diagnosis for people in Alberta. And we want the best for Albertans, Mr. Speaker. We're going to continue to do that.
Calgary Edgemont.
Given that when the Alberta NDP was in government, they knew prioritizing early detection would make treatment of these cancers more successful, and given that the Alberta NDP government built a comprehensive cancer centre for that reason, and given that this government just tabled a $9.4 billion deficit that fails to properly fund ways to speed up cancer surgery, screening and research, why has the Minister of Primary Health failed to prioritize the urgent needs of Alberta women cancer patients? Where did the money go if it's not for reducing wait times?
The Honourable Minister of Health.
Mr. Speaker, the members opposite do not know what they're talking about. We have increased our screening program significantly, and we're going to continue. I also want to show that in cervical cancer screening, we're transitioning to HPV testing because it's a more effective approach that detects risk earlier than the Pap test. We are expanding access by further launching an HPV self-sampling pilot, Mr. Speaker. We're going to include the lung cancer screening. We've got a mobile unit, Mr. Speaker. We never had that before.